direct primary care. Again, my name is Dr. Truty. I'm owner of Balanced Physician Care, located here at the beaches in the St. Johns County area. And I'm here to talk to you about what exactly is direct primary care and what we do here at our practice that also goes beyond the scope of just direct primary care. And we're going to talk a little bit about you as a healthcare purchaser, why you would pick direct primary care for either you as an individual or for you as a business owner. So direct primary care is really a unique healthcare solution that has been growing throughout the country. We're one of the first practices here in the Jacksonville, Ponte Vedra, St. John's area to do this practice. And it's been growing quite a bit throughout the country. When I started this type of practice about 4 years ago, there was probably only about 600 practices, and it's growing to over 1,000 right now. It's certainly on the minds of legislatures here in Florida and both at the federal level. So that tells you the scope of the physicians and the healthcare practices across the country that are using this direct primary care model. The Florida legislature in 2018 passed a law that made sure that we were not classified as insurance, but rather as, a membership-based program, because that's really what we are. And right now, there is a bill in the federal legislature so that we're going to be able to use funds from an HSA to pay for the membership. We're going to talk a little bit about HSAs and FSAs later on and how what are the rules regarding using membership dollars for that. So what a lot of people, when they hear about membership medicine, they hear about direct primary care, they say to themselves, well, that's concierge care. You're doing a form of concierge care. But that's really not the case. Direct primary care is not your average concierge practice. What sets us different is that direct primary care charges a periodic fee in exchange for services, and that can be monthly, that can be quarterly, it can be yearly, based on the practice. We do it monthly, but we don't bill any third-party payers, and usually concierge medicine, they're not only charging you a fee, but they're also billing third-party payers like an insurance or Medicare for the office visits and services that they provide as well. So really, direct primary care is meant to be an affordable solution at no matter what level that you're at for a membership. Obviously, it's different than straight self-pay, because the idea is you join a part of a practice, a part of a culture, where then you have services and healthcare and help at your fingertips. So what makes direct primary care special? I mean, why are you even here tonight taking a few minutes out of your evening to discuss this? Well, I think the best way to talk about direct primary care is to compare it to healthcare and what's out there and what type of health care coverage do you have. And what's interesting is that a lot more people are paying out of pocket for healthcare. You're paying cash. So even though patients have insurance plans, whether they're self insurance plans, whether they're insurance plans that they pay for, whether insurance plans pay for from an employer, a lot of these plans are really high deductible plans. And so according to the CCC 2 years ago, actually 3 years ago now, 40% of adults had a high deductible health plan. And that's up from 26% in 2011. And I venture that in the past year, those percentages have gone up even further. So most of us really, for the basic everyday healthcare needs, are paying out of pocket, because when you have a high deductible plan, you're essentially paying cash for your labs, your x-rays, your MRIs, and your medical visits to some extent. Yes, maybe some wellness visits are covered 100%, but a lot of things are not. According to a Gallup poll, almost 10% of people are uninsured. So again, we're looking at numbers of over 50% of people who are paying, healthcare. And I'm sure if you're listening to this talk today, you or someone you know primarily is paying a lot out of pocket. And so I think as consumers, we have to ask ourselves, what are we really getting for that money? I mean, whenever we're spending money out of our own pockets, all of us, look at, okay, what is the value? And let's talk. I mean, what is your typical healthcare experience like? I mean, I feel like the typical healthcare average experience now is pretty awful. Let's be honest. I mean, when you need to go see your doctor, first of all, you need to go in. There's just not any way right now in our health. There's very few avenues for you to see your own doctor or talk to your own doctor online or over email personally. And if you do want to go in, you really can't be seen the next day by your own provider. Yes, maybe you can be seen in a couple days by another provider or another physician extender, but your own doctor or your own provider, often you're not going to be able to see the next day or the same day if you need to. And a lot of times it's taking a couple weeks to get in to see your physician. And then, so that leads us to maybe going online or in urgent care and talking to people who really are not our own physicians. And then, you know, let's be honest, when you actually get to the office, I mean, you are probably waiting at least a half hour. I mean, maybe more. I mean, when I worked in traditional practice about 5 years ago, some of my patients were waiting an hour. And then when you get in, really, most providers really only have about 10 or 15 minutes with you. So it doesn't leave much time to go over things in depth. You're either writing a prescription or you're writing a referral or you're, doing something very, very quickly. And there really isn't a lot of time to discuss options, to discuss nutrition, to discuss things beyond prescription. So I think if that's something more that you're looking for, I think direct primary care is really a difference. I mean, it asks the question, can healthcare be different? Which I believe the answer is yes. And then it kind of goes further and goes, well, maybe not only can it be different, but it really should be different. Um, uh, First of all, direct primary care delivers personalized medicine. So, a membership, direct primary care, the doctor is able to spend as much time with you as you need. So, all of our visits in our office are all standard a half hour. And if you need more time, hey, we can schedule a visit for longer. And a lot of times if I don't get to everything, I'm going to be able to maybe even schedule a phone call the next day to finish things up. So again, there's no rush. We have time to go over everything. And it gives us time to make sure you understand all your options and you really are making your best choice for you as a provider. Because if you don't know as a patient, so if you don't know what all your options are, you don't have the time for that all to be explained to you. How can you have the choice that you want to have? And then a relationship is developed over time where the doctor gets to know you personally really well. How do you like your healthcare handled? Do you want to be seen a lot of times in a year just to get everything done? Do you like to do a lot more things over email? There's sort of a way that your doctor gets to know you and understand you. Most practices, most patients don't realize most doctors are taking care of patients, about 2,000 patients in their practice. I mean, that is a lot of people. And so in this type of membership model, we're really only taking care of 400 to 600 patients in our panel. So it leaves us time to really get to know you well. And I know you asked the question, well, okay, that's nice. You get to know me really well, but does that lead to better health? And the answer is yes. I mean, there's a study published by the British Medical Journal that shows that direct primary care model leads to less hospitalizations, less high cost diagnostic tests, and less emergency room visits. So if you're paying out of pocket for your health care, you obviously want to be able to save. You don't want to have to go and pay a lot of money to an urgent care or go to an ER. So if you have a relationship and the ability to see your physician 24/7, you're going to access that, and that's going to lead to better care. Direct primary care promises, again, this personalized medicine, but also convenient care. In this type of membership, we're available for you for urgent visits on evenings and weekends. So if something comes up on a Saturday night, you just give our urgent line a call and you're going to hear from me. And we'll decide what we need to do. If it's something that, we can take care of over the weekend, we're going to do that. But if it's something like stitches that you need to be seen right away, as long as I'm in town or one of the providers that I work with in town, we're going to meet you and take care of it. It's kind of that old Marcus Welby, having your own personalized physician at your fingertips. We're also convenient to you because we can do a lot of things over the phone. I have patients who live in Palatka, who live up in South Georgia, in Brunswick. So I have patients who span the entire, Northeast Florida and Georgia area, who are our patients, because I can see a lot of people and talk to a lot of people over the phone. I mean, in traditional healthcare, we're handcuffed by the way things have been set up, where physicians only are reimbursed when you come into the office, and no fault of their own. That's just the system. But with this type of membership-based medicine, we can really come to you like this. We have great, access now to the phone and to video chats. And so we're able to do visits like this face to face over the phone and talk about what's going on. So a lot of care can be managed remotely, making it convenient for you. And a lot can be done over email. Hey, I just need a refill, or hey, I have a question about something I read on TV. Is it good for me? We have that convenient care for you. So, and then we try to work on helping to coordinate your healthcare, being that key point for you. If you need an X-ray, if you need an MRI, where is it in the process? Has the results come in? Have the specialists gotten everything that they need? We're here for you, working to try to help you coordinate and work through the system. I can't promise that it's still not slow at times because of other influences in the system, but you got somebody in your corner, a relative, the next best thing to having a doctor in your house there for you, helping you to manage the system. So those are all the principles of direct primary care. The last, what I think is most important for those people who don't have health insurance or who have a high deductible plan, is that we really try to focus on cost efficiency. So if that's important to you, this is not, again, just concierge care. This is direct primary care, where we're trying to take care of people who might not have insurance, or again, who have a high deductible health plan. So we're really mindful of cost, especially if that's important to you and to your family. We're going to go out in the community and help you find quality places to get radiology, lab work done at the best affordable price. And we're going to help you manage that. We're going to look at prescription plans and where the best cash pay prescription is, because it's not always at the same pharmacy all the time. We work to find discounts on labs. And at our office, we even offer a specialty consult service that I have access to. So, like, for instance, I had a patient who had a clinical issue with a nerve problem, and I was able to send a consult through to the specialist to see if we were on the right track with the medication that we were doing and if they had any other recommendations for care. And they gave me one or two recommendations, but basically said we were on the right track. So that saved the patient a visit to the specialist that would have been costly to get that same sort of reassurance. So we're always trying to provide value, especially here at our practice, bad balanced physician care. So direct primary care, we've talked about how it can be, a solution for the individual. I just want to take a second to talk about how it can be a solution if you're a business owner. A lot of people are looking for options on how to, keep really good employees. If you're a small business, you want to keep good employees, but it's often hard, with the bottom line to be able to offer really expensive benefits. And direct primary care can be a membership that you offer to your employees, and so that they have a doctor at their fingertips, especially in cold or flu season if they get sick, helping to keep them well. So, direct primary care is worth looking at, if you have a business. So how does direct primary care work with insurance? So if you are a individual and you're like, okay, this membership sounds good, it's providing me good quality care, I'm going to get a personalized relationship with my physician. In the long run, it's going to save me as I'm going to look for x-rays and radiology and those other things. But how does it work with insurance? So, we look at direct primary care as being something that works with almost any type of insurance. So if you have uh, uh, regular no health insurance, direct primary care will work. I mean, it's not an ideal. You don't have anything if you need to go to the hospital or you need to see a specialist. But for some people, they're going to just save money and put that away and use that if they have an emergent issue. It works really well with a high deductible healthcare plan. So if you have a high deductible healthcare plan, where your deductible is $10,000 and above, I mean, direct primary care is great because you pay just this little monthly fee and then you get all these services included. It's like a flat, transparent fee. You know what it is, you know what you're going to pay, and then that includes all of your doctor's visits. So there's no surprise. The hardest thing that I have to talk to patients about when they're self-pay is that the fee for the visit is really going to depend on how many medical problems you have, how many prescriptions I have to write, how long we're in the office. So I can never quote anybody an exact fee. And I know that's frustrating for patients because they want to know, okay, when I come in, doc, how much is it going to cost? That's the problem with self-pay, because it really only in the moment are we going to know exactly how complex the issue is. And it's a judgment call by every provider. And the nice thing about the membership is it takes away that confusion. You have a flat monthly fee, and then you're able to know, hey, no matter what I go in for, that's the fee, and I'm covered. So again, circling back around. So high deductible health care plans, no health care plans. It certainly works with employer-based health care plans. Even if you have a low deductible plan, still the benefit of having a relationship with your physician, having them at their fingertips. If you're a business person and you travel a lot, we can take care of you out of town. I have a lot of patients who spend half of the year here, and then in the summer they spend the year, in a cooler area, and I'm still able to take care of them. I have patients who travel a lot, and if they're, in another state like Illinois, I'm able to take care of them. So again, even if you have good employer-based health insurance, direct primary care works with almost any type of insurance. So I want to take a second and talk, though, about a unique healthcare solution, though, for people who might be looking at, healthcare um, and looking for something other than their typical health insurance plan. And that's something called a health share. So it's not health insurance, but it's a health share. And so it works very similar to insurance in the sense that you are paying a monthly fee, and you're paying into this share, and then when you have a bill, like let's say you go to the emergency room and you get a bill from the hospital, then you submit that bill to this health share, and they work on your behalf. They call the hospital up, they negotiate the pricing down for you, and then they pay their shared amount. So the shared amount kind of depends on what your monthly payment is and what level that you pick, and then that depends on what percentage of the bills. So it's basically a group of individuals who have come together to say, okay, we're going to help each other pay their bills. It originally grew out of the Christian church. So there are a lot of health share plans that are Christian based. And then there are some nowadays that are not. So it works for any type of person who might be thinking about this. And again, you pay your monthly sharing amount similar to a healthcare premium, and then you receive discounts on healthcare and limits on out-of-pocket expenses. So if you do have that, motor vehicle accident that puts you in the hospital, again, these health shares have grown so large and have so many millions of covered lives and span so many states. They are able to really provide good coverage, just like a catastrophic plan can. Now, I'm not, I'm a physician, so I know a little bit about this, but I think if you're interested and it sparks your interest, I mean, I think a lot of patients come into my office and just say, gosh, I'm paying so much for my health insurance, I'd like to look at other options. I think it's worth calling up and talking to someone. This is one of the health shares that we often talk to our members about, to patients who come in who are interested in the membership but don't have any insurance and are looking for another option. We really try to have people check out Sedara. If you have another Christian health share, I still think it's worth maybe looking at Sedara. It's more secular, but Sedara.com, or their phone number is 800-473-5472. And we really work with them because they understand the value of the membership. They understand that we're working to bring costs down. And it's at our level because I know the patients well. I know what testing we need to order. I know when we need to order a more expensive test, when we need to order, maybe a less expensive test based on the patient's needs. And so Sedara recognizes that and gives discounts to anybody who's a part of their health share, who's a part of a direct primary care plan. And these are the membership contributions that they have and the different levels they have. And these are special rates based on if you are a member of a membership-based direct primary care practice. So we like to say, hey, you've got this direct primary care. You get unlimited visits with no co-pays, no office visits charges, a flat, transparent fee. You get same day or next day appointments. You get direct access to your physician 24/7, especially in emergencies on evenings and weekends, so you avoid ER visits and urgent care. And then we help to manage cost on labs, x-rays, and medications. And you couple that with this larger health share, which can take care of the larger medical costs. And I think it's a good alternative piece of the puzzle to people who are really looking for alternative solutions. In our practice, we uh, also, offer a, let me go back to our slides here, um, a family plan. So, so that kind of goes over direct primary care. Direct primary care can be a solution for any type of person. If you, it brings to you as an individual personalized medicine where you get to know your doctor really well. You're not brushed aside to see other people. You have direct access to your doctor, by phone, by email, and we provide you convenient care no matter where you are. Modern access through telehealth makes things a lot more easier. And then again, as I've spoken about the last few slides, we're really working on providing you that cost efficiency by finding you and helping you manage finding discounts on x-rays, MRIs, and labs. At our practice, we offer a set of wellness labs for anyone who's a part of our Premier plan. And again, the coverage types, it goes with any type of insurance. And if you're a business owner, it really can be a solution if you're part of a 50 and over group. If you're interested in a self-funded plan, direct primary care can really help make that self-funded plan work very well. And if you're a small business, I think it's worth looking at as a great benefit, and be happy to talk to any small business about that. We offer discounts, especially when we have, people who have small businesses that are 10 or more employees. So what is our plans like? So first of all, a little bit about me and about our practice. I have over 15 years of experience in primary care, women's health, and pediatric care. I used to work at a family practice residency program where we delivered babies. So I take care of the full spectrum of primary care. I do women's health, female exams, vaginal exams. So all of that, when you join our membership, is at your fingertips. All of the education and experience that I have, I bring. Our goal is to try to keep you here because you're paying for your monthly membership. We're going to try to take care of as much as we possibly can. Most studies quote that most primary care physicians can take care of 70 to 80% of healthcare needs. I'm board certified not only in family medicine, but in sports medicine. I used to work for an orthopedic group a while back in my career. I did a lot of coverages of a lot of professional events. And so I'm able to bring, sports medicine to the practice as well. So if you twist an ankle, you're a runner, you're dealing with issues like that, that's all part of our practice. I also am trained in holistic medicine. I did an integrative medicine fellowship with Dr. Weil. And so I really bring holistic medicine to the practice. I also do acupuncture. And that's one of the unique things about our practice is not only do we do basic primary care, as I've talked about throughout the slides, but we offer a premier plan where I really integrate holistic medicine. I do hormone replacement therapy. We offer IV therapy. And again, I do acupuncture. Some people are not interested at all, but some people are interested and would love to do it, but just, haven't been introduced to it. So we add that as a benefit into our practice. So you get all of this together as part of our practice. These are our two plans. We have a basic care plan and we have a premier care plan. And as you can see, both of these are included. So the premier care really is about me. People who join that plan are going to be seen primarily by me and me alone. And that includes all of the hormone replacements, all of the holistic care and consultations, and it just gets weaved in throughout what we do. I have nutrition background through my fellowship, and we add that all in. So that's really for people who just want a flat, transparent fee, don't want to have to think about anything, and sort of get all of these things together. And then we have a basic care plan. I have a nurse practitioner. Her name's Arlene, and she's fantastic. And she works with me to take care of the patients who join our basic care. And the basic care is the whole direct primary care package. It is having access to email, having access 24/7 to your physician, really that direct primary care promise. But we realize some people, they may not come in the physician that often. They want to have the relationship. They want to know that they've got someone in their corner. They want someone to help them negotiate the system. But, they feel like they just really want basic care. They don't necessarily need a lot of the holistic care or hormone replacement. So we have basic care at $69 a month. And then we just add a little small visit fee when you do come in of $25 per visit. And if you're a basic member, if you really want to do a more in-depth integrative medicine, holistic consultation, that's always something that we can talk about. But again, with the premier care, that's primarily for people who really want that integrated in every aspect of their care. So that is, our fees about our practice. And so, all of this is available online. Or you can simply, give us a call, and we'd be happy to go over any of this with you. Give us a call at our phone number, 904-930-4774. And if this piques your interest at all, we do free 10-15-minute consultations with anyone who's interested in joining the membership, because I know it's one thing to hear about it, but everybody has specific questions for themselves that they want to know. And so that's really what the consultation, meet me, make sure that you feel I'm the right fit for you. We can do those over the phone, or we can do those in person if you want to see our office and meet our staff and find out what we're about. We really know that this is new, and we want people to feel comfortable. So hopefully this presentation today has given you an understanding of what I really believe is a sea change in healthcare, bringing it back to that relationship so that you have someone in your corner with your provider or your physician. And I think that this concept is a great way of delivering it in a very affordable way. And that's why, I started this practice 4 years ago. So if you have questions, please give us a call. We have some upcoming events if you're interested. We're going to do another DPC webinar. This is a little bit old, but obviously today we did one, but Saturday, December 14th at 10 a.m. if you have friends or family members who are interested. We're also doing a real fun event at True Foods. If any of you are in the Jacksonville area and know the True Foods restaurant over in the St. John's Town Center, again, I did a holistic training with Dr. Weil, and he's part owner of the restaurant, and it really delivers healthy Mediterranean diet based food in a very fun way. So we're going to have that event December 5th at 6:15 p.m. You can go to our website again, and we have an area by which you can go ahead and click on and sign up for that. It's $10 for members, $20 for non-members. And we often do events like this throughout the year to kind of continue to add value for our members about different health topics. And our other event will be a little later in December. It's Beauty and Below and Beyond. So it's sort of talking about all the different procedures that there are for you to look your best. But from my standpoint, looking at what you can do internally to make yourself feel better and look better. I mean, a lot of looking better on your face or on your skin actually comes from what you eat and detoxing and things like that. So we're going to talk a little bit about that. I always sponsor a Tai Chi event. It's the last Saturday in the park. So if anybody has ever wanted to try Tai Chi, come on out. We're a very friendly group. If you don't know what you're doing, it doesn't matter. We don't do anything really complicated. And if you're in Jacksonville, you know where Oceanfront Park is, and that's November 30th at 8 a.m. Again, all of this is always posted on our website. So thank you so much for attending our webinar tonight. We do have a chat function and a chat feature to talk if you've got any questions. Again, our website is balancedwithadphysiciancare.com, or you can send us an email if you have any questions. So I'm just checking here to see if we have any questions that have come up with the chat. I don't see any questions here. So again, thank you very much for attending tonight and checking out our webinar. And please stop by at one of our events or give us a call. Have a great Thanksgiving weekend coming up, and take care. Bye-bye.